Joseph Massad, and actually I'm from Tulsa, Oklahoma. I've been in practice for 48 years. I started in 1975. Scanning is very, very easy to do, and it's very predictable. When we first started using the oral scans, the patients were, of course, right now we'd be doing it so much that they just say, I can't wait to do a scan because I hate to do an impression because they don't like that. So yeah, it's real positive for the patients. For me, I really like the intraoral scanner because you have a pedo head. A lot of these companies don't have a small. So I have patients who sometimes can't open their mouth that much. So I really like the small one. So you have a pediatric one. But it's very easy. You can just move back and forth. And if you get your algorithm, you should be able to do a very, very nice scan. The cleanup is real nice. Okay, a lot of times you have to go back in and cut a lot of things out. And with the auto clean, basically, it's much, much easier, especially for my dental assistants when they're actually doing the scans for me. The first thing you look at is the price is very, very, competitive. So you would think maybe it would be inferior. No, it isn't. It's actually as good as one that I, in the past, had was probably 3 times, the cost. So now I can have 3 versus have 1 for the same price. And it's very, very accurate. So I think this is affordable for many dentists across the country.
My name is Micheal Stephen. I've been in practice since 1985. The last about 15, 20 years, I've been focusing more on more restorative aspects of dentistry. I've enjoyed the technology boom that's happened, especially in the last 10 years in the digital workplace, how that can be incorporated into the dental practice, and as far as not just functions as far as scanning for crowns and implants, and but also in diagnosis, and how this digital technology basically integrates and works as one workflow, and how it's benefited my patients and myself in how I diagnose and how I treat patients. At this time, we have the Aoralscan 3, the AccuFab-L4D, the AccuFab-D1s, and the FabCure, along with using their iCloud-based software for pulling up old patient scans. The Aoralscan 3 is very intuitive. It has several functions on it that help us scan a lot more efficiently, faster. The AI function gets rid of any scattered debris that you may get in there. You can also clear up with another function. You can clear up any debris that missed. And also they have a function in there for any reflective surfaces. Now this is very beneficial for us in this practice in that we do a lot of overdentures. So we have highly shined prosthesis that allows us to scan more accurately and faster than with conventional scanners. Along with this, if the patient has gold crowns, it's just a more efficient way to do it, and we don't have to keep going back over, and we can scan relatively fast in the mouth without having to do a lot of correction afterwards. I found that using the Aoralscan 3 allows us to communicate with the patient better. People see in 3D, we found that the communication is better, and the people understand what needs to be done better. When the patient leaves, they have a better understanding of where we want to go and where they want to go, so we're all on the same page. With the oral health report, the biggest thing I find is the QR code, both for the lab and the patient. I always send the patient home with the QR code. That way they can look at it at their leisure, because they're getting a lot of information thrown at them at one time. And so this allows them at home or wherever just to sit down and look at it. So I think the biggest thing that on the oral health report is it gives them something to take home. And then the second thing is communication with my labs and specialists.
I do a lot of printing, okay, and I do this to test it. And so it really is nice to have both of the systems, analog and digital.
Your printers are easy, they're fast, and they're clean. And I don't have too much trouble. The fit is always good. That's probably a combination of the two, the scanner and the printer. They talk to each other really well. I like it for making lease trays, doing models for patient education or for wax-ups. I like using it for night guards or orthotics. It's very fast, very easy to use.
Well, you just ABC, so it's nothing to it, okay? You go ahead, you design it, switch a couple buttons, and it's going to do it for you.
The thing about having a printer along with a scanner in your office is we live in a drive-through society. People want things fast, but they also want quality. It kind of sometimes those terms contradict each other, but if I have a problem, if I need to get someone into some sort of night guard, orthotic, or a temporary bridge, we can get those things done without having to send them to the lab. Patients appreciate that. All we have to do is press a button and later on that day or the next day to come by and pick up their night guard. How I see with Shining 3D products is that they're adding products all the time, but they're adding products in a way that they all talk to each other and that they're readily accessible to each other. They're always going to be cutting edge. They're always going to be adding products to their armamentarium as we move on. Their products are going to do more. But the biggest thing is data acquisition, meaning that they all talk to each other, that they're all on a central platform to where you can access them and they integrate together easily. I think that this is what it's going to do. It's just going to be integrate to a point to where it is just part of the practice. And I think to a certain extent, patients are going to demand that you have that technology. I think that's the big thing. All these components that Shining 3D have are going to be closely integrated and are all going to be like really just one system. You may have different mechanisms for getting that data, but it's all going to be one system, and it just becomes part of your everyday workflow, whether it be diagnosis, whether it be treatment planning, whether it be producing crowns, implant crowns, night guards. It's all one, and it makes your life so much easier.